In the UK, nurses are set to begin round 2 of their strike. Nurses across England will go on a 2-day strike starting today, and health services are expected to be hit across hospitals and community care centres. Officials have warned of big disruptions. This second round of strikes by nurses after the Christmas weekend comes after the UK government and the Royal College of Nurses failed to reach a settlement on increasing pay amidst a cost of living crisis. The latest industrial action puts further pressure on the state-funded NHS. According to the UK Health Secretary, 2 days of strikes by nurses in December led to the cancellation of around 30,000 elective procedures and outpatient appointments. Despite the problems caused, the striking nurses do have public sympathy. In a YouGov poll, 63% of respondents support the nurses' strike. And the support is driven by the fact that soaring food prices and energy bills in the UK have hit the lowest income workers hardest. But 10 Downing Street still believes it is not the right course of action. The government continues efforts to implement the UK strikes bill, which will ensure minimum service levels. The new bill gives the government the power to unilaterally assert levels of service provision from striking workers in key sectors. The bill also gives union bosses the authority to fire striking workers. Unions can also face legal action. The unions have already called the bill undemocratic, unworkable and illegal.
Let's all of us, united, send a message across the road to 10 Downing Street. We will fight tooth and nail to protect the right to strike.
UK ministers have repeatedly claimed that the International Labour Organisation, the ILO, supported the government's plans to enforce minimum service levels. But in the latest, the head of the UN's Agency for Workers' Rights has denied that the organisation backs the UK's tough new laws against strikes. Well, for more on this, we're joined by our correspondent Alex Isaacs from London. Alex, of course, this is not what anybody wants to see. Nurses on strikes. It will give people in the UK obviously concerns about if they need the service of nurses and hospital. What is the latest, and how is this going to now play out over the coming days?
It's unlikely to stop over the next coming days. We're still going to see a strike today and tomorrow. That's what the RCN, the Royal College of Nursing, has promised. But it doesn't actually affect GPs, and it only does affect 25% of NHS trusts around the UK. There is about 1 in 4, so that's not all of them across the country. So it may not affect people where they live, but it still will make an impact on services within hospitals themselves. It's going to be similar to a bank holiday style staffing, where RCN has promised that they will cover a minimal level of service. They said that they do that anyway because patients are their priority, and that's why they're striking. This is not just about pay, this is about ongoing changes within the NHS itself. They said that they want the government to do something and act quickly. However, there's been constant talks with Steve Barclay throughout, not just the nurses, but all of the NHS, to try and move things forward. But we keep hearing from the government that they aren't willing to give any pay rises out, and that has been confirmed again today. Even though inflation has gone down 0.2%, the government said that if they give pay rises out to any of the public sector workers, then they will have to give them out to most of them, and therefore the rest of the country will suffer as well. The people on the ground, the people that are having to use the services, there is a slight strike fatigue, and even though there are a lot of people that are behind the nurses and do want those workers to get extra pay, in general the strikes are coming so often that the public are feeling a little bit wary of what is actually going on. And if you ask the person on the street, they probably couldn't tell you exactly who's striking today, but they would just assume that most people are. The government really needs to push things forward and actually make some changes soon.
Alex Isaac, many thanks for your insight there.